publicly accessible, but also supporting our
Opposition MLAs had the opportunity to ask government what the plan is for the mental health campus during a standing committee. Liberal MLA Carolyn Simpson brought up a personal story about a call for help for her husband who was struggling with mental health.
He doesn't get this care, he's not going to make it. You have to help me get him his care. And I was denied, and he committed suicide 3 weeks later. So listening to families has been a gap that I've lived firsthand for 15 years with mental health and addictions.
Simpson says being denied access for him may not have changed his outcome, but as the province puts together a new mental health campus, she says the government needs to think about how to better improve services for family members advocating on another's behalf.
He needed an intervention that I knew he was going to have against his will. And I tried everything I could to lobby for that, and I just wasn't successful. I wasn't heard.
Health P.E.I. says it's working with families to understand how to better help struggling family members, especially children.
I hope, and I'm truly confident that a similar situation today, we would be able to provide more options. And we're certainly working with families in many of our child and youth programs, recognizing the importance of family member involvement.
Green MLA Carla Bernard wanted to know more about early intervention. She says student well-being teams set up in schools aren't enough.
If we really want to get, when we talk about early intervention and prevention in this province, we have to recognize that this starts back with children. And so what supports can we beef up our schools with so that, that children get the best start at a healthy, productive life?
Health P.E.I. is working with educational partners to identify those at risk.
Our education partners are best situated to be working with young people on a day-to-day basis and identify those opportunities.
When it comes to the timeline for construction for the new mental health campus, the plan is to have the Mental Health and Transitions building opened by fall. And the hope is to have this all completed by 2028, including decommissioning of the Hillsborough Hospital. Tony Davis, CBC News, Charlottetown.
If you or someone you know is struggling, you can call 988. That is Canada's suicide prevention hotline. Or young people can call the Kids Help phone, and that number is 1-800-668-6868.